Are you living in pain? Is it joint pain or muscle pain? If so, stay tuned. Welcome to Living Pain Free with Dr. Marc Darrow from the Darrow Stem Cell Institute in West Los Angeles. This is the program that can give you effective solutions for the pain you've been living with. Dr. Darrow is a medical doctor, board certified in physical medicine and rehabilitation. He teaches about the use of prolotherapy, PRP, and stem cells. Today's program could open up a new life without pain for you. Now, here's Dr. Darrow with his co-host, Dr. Nita Valens.
Well, hi there, Dr. Darrow.
And hello to you, Nita Valens.
How are you today?
Living it up, as you love to hear.
I love to hear that. I love it. I love what our announcer just said as we entered the program about people living pain-free, the name of the show, because we want our listeners to be pain-free and take care of their musculoskeletal issues. Basically, that means orthopedic issues, which is if you have joint pain, tendon pain, ligament pain, disc pain, back pain, neck pain, hip pain, knee pain, arthritis pain, if you have stiff joints or dull aches and you can't quite explain or understand what's going on, then this is the program for you, and you want to give us a call right here in the studio at 866-870-5752. That's 866-870-5752. There's a lot of information on Dr. Darrow's website at www.lastemcells.com. That's www.lastemcells.com. You can email him off of every page on the site and watch him performing the treatments on video. It's very informative, and letting you know we're here Saturdays at 10 a.m., again at 1 p.m. When you call the program today, you get Dr. Darrow's latest book for free. The title is Stem Cell and Platelet Therapy, Regenerate, Don't Operate, which is what we're all about here on this program. Again, that number to call right here at the station. Get in line. I have lines open, 866-870-5752. Your turn.
That was sweet, Nita.
Thank you.
I'm going to go to a question right off the bat.
Okay.
It's on. It says knee, and the person who sent it in said, by the way, to get to me with these emails, which I answer from when I wake up in the morning till when I go to sleep around midnight, in between patients, I'm doing emails. And this person wrote to me through the website, which is www.lastemcells.com, www.lastemcells.com. Every single page on my website, which is voluminous, has a spot for you to email me, and I'd love to hear from you. So this person writes, I have long-standing problems with my left knee. I'm 58. When I was 20 years old and in the Army, I had my first arthroscopic surgery on my knee. I had a second arthroscopic surgery on that same knee around 2006. I experienced sharp pain, stiffness, and a locking sensation in the back of my knee and all around, especially at night. My doctor has said it's minor arthritis, but now it is worse. I have Kaiser Insurance, but they do not perform PRP. PRP, by the way, is platelet-rich plasma. Very simple process where we draw blood from your forearm, what's called the antecubital fossa, and just the same place where your doctor draws blood to do your labs. And we spin that in a centrifuge. We then throw away the red cells that hurt, and we inject the platelets, and that is a healing type of procedure. It stimulates tissue to regrow and regenerate the knee or any other part of the body. I inject the whole body, back of the neck, head, and shoulders, elbows, wrists, fingers, toes, knees, hips, low back, you name it, and everything in between, really. So anything in the musculoskeletal system, if you have some type of disease process going on, I don't work with that. I do orthopedics. So it's musculoskeletal system. I don't do IV PRP or IV stem cells. The FDA doesn't like that at this point. And by the way, the FDA is going to supposedly come out with an edict. It was supposed to be in November this year, but they've postponed it to next June. I guess because of what's been going on with the pandemic. They've been very busy. So by next June, which is quite a few months away, we should have a directive about what we regenerative medicines can inject and can't inject. And right now, it's kind of like an open field as long as we're not hurting people. So they occasionally do go after people. They went after a company that injected some eyes and blinded people. We don't do that. And so they have very minimal, I'll use the word invasion. It's not really invasion, but they're not doing very much to block people from using stem cells or PRP at this point. But as of a year from now, we'll know more about what they want. So the doctor is suggesting knee replacement surgery, which I rarely ever would like a patient to have. I see too many bad outcomes. I would like to explore my own options. Good idea. Would like to make an appointment with Dr. Darrow. Please call or email. I'm a general contractor and have busy mornings, so afternoons are better for me. I don't have a recent MRI. The last one was years ago, and I can't find that CD. Looking forward to hearing from you. Now, most of the time, I don't need an MRI or an X-ray. I use my hands to figure out what's going on. But I do like to get it, just, I'll call it for medical, legal reasons, just in case I don't miss anything. We can usually tell within a couple minutes by just touching the body whether or not PRP or stem cells can help the patient. So this person, I wrote them back right away, and then they wrote me back again. They said, thanks for getting back to me. Your email fell into my spam folder, so I missed it for a few days. A few years ago, my knee was bothering me more than usual. I went to see the orthopedist at Kaiser, did an MRI, said I have minor arthritis now. And the only resolution is a partial knee replacement at this point. Well, that's a lot of malarkey as far as I'm concerned. Most of the patients we have come in who have been to an orthopod tell me they have to have a surgery, and we can usually heal them or get them better without the surgery. The patient says, I've already lost a lot of meniscus. He prescribed some pain meds, but I didn't take them. I think that's smart. I don't think the pain meds do anybody any good. I do take turmeric and glucosamine. Those are good things, and they both seem to help. I'm quite hesitant to do the knee replacement, and I'm quite hesitant to have you do it, only as a last resort. I've been able to continue working. I do some walking and hiking, and that lets me know that the person's really doing pretty good. I'm always nursing and careful with the pain. I gave up on playing sports, racquetball, skiing, basketball after my second arthroscopic meniscus surgery in about 2006. The surgery was done by, I won't tell the person's name, but the doctor is one of the best known in LA. Truth is, I've missed participating. It's been a lot of years. I will wait for your staff to call me for an appointment. Please have them call my cell at, I won't give the phone number, and then their name. So I think this person has an excellent shot at getting better with regenerative medicine, and that would be using PRP or stem cells. And I don't have the answer yet on what I would want to use, and that's something that is negotiated at the time of the appointment. And we have to see by moving the joint around. I don't really care what the MRI says. I like to see it, but I'm more interested in moving the patient around, touching the area, see where the pain is being generated from, and not necessarily relying on what an orthopedic surgeon says, because unfortunately we know what their, I'm going to say it, what their God is. Their God is surgery. And I was in training to be an orthopedic surgeon until I had my orthopedic surgeon professor operate on my shoulder, which I'm not going to say destroyed it, but it made it really bad. I mean, it was bothersome, and then the surgery made it terrible. And it wasn't for a couple of years after that that I discovered regenerative medicine, and I injected my own shoulder, and it was 100% completely pain-free and full range of motion the next morning when I woke up. It was an awakening for me, because my God was orthopedic surgery back then, and then my new God became regenerative medicine using PRP and stem cells. And I have injected both my shoulders myself. They're both amazing. I'm lifting my arms up and flashing my hands back and forth on the video, which we're taking at this moment. And I'm very happy with the treatments that I did. My knees are great. They were miserable before. I have also injected my right wrist, my elbows. I haven't been able to inject my neck and back when I had problems years ago with that. I had to have someone else do that because I can't see back there. And I didn't want to do it in a mirror because that's more of a touchy spot to do. But I do know some docs that actually do inject their own neck and back, which I think is a little touchy. So I've had great luck with this on me. I've been doing this for since about 1998, and I get 60 to 80 new patients a month. I am very, very busy. I am told I'm the busiest regenerative medicine doc on the planet. I don't know if that's true, but I'm a very busy guy. I love what I do, and I love watching people heal. People ask me, what do you do for a living? I go, I watch people heal. Now, not everybody gets better, because some people don't listen to me, and they're too active after they get their injections. They need to chill a little bit. Or they quit treatment. They go back to their orthopod, and the orthopod says, well, that can't possibly work, and then the person quits. So we have a lot of reasons for failures, but most people do get better, and I can usually tell in the beginning, and I'm very honest with people about whether I think they're a good candidate. If I think they're not a good candidate, I'm going to tell them right there to their face. So don't get mad at me if I tell you that. I don't want to take care of people that I think are wasting their time. So
that's pretty honest. Pretty straightforward. I like it. Well, if you're sitting there in pain listening to this program, you might want to give us a call here in the studio at 866-870-5752. That's 866-870-5752. And you get a free book. It's called Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. I think it's great when you talk about how it's good to do the least invasive thing first, which is this.
Well, absolutely,
right?
Yeah. No, there's less invasive things than getting injections, which is what I do in regenerative medicine. The first thing is rest the area a little bit if you're really super active, and see if that lets it heal. Some people just can't rest. They're just they're ADD with sports, and I have to raise my hand. I am one of them, and I usually, when I start having pain in a tendon, ligament, or joint, I'm going to keep going and hope it just goes away. And there's been many times when I've kept going a little bit too much, and then I'm stuck for a while, and then I have to inject. But I like all kinds of medicine. I don't care if you use homeopathy. I've done that. I've used acupuncture on my body. There's many things. Physical therapy can sometimes be helpful. So what I do is not the least invasive. It's not the most conservative, But comparing it to surgery, my God, it's like nothing. You walk in the office, you get some injections, and you walk out. Even people that have knee problems or feet problems can drive home. So people drive themselves to the appointment. A lot of people do bring their spouse or friends drive them, but it's not necessary. And they drive themselves home. So it's a pretty simple procedure. And we just take your cells and we inject them into the problem spot, and then you're ready to go. So do you want to say something, Nita? We could get some callers. That would be more fun, wouldn't it?
Yes. Our number here at the station is 866-870-5752. That's 866-870-5752. And I have lines open for you right now. Do you want to mention what's going on in the office besides this for a minute?
Yeah. Although I do regenerative medicine on the joints, ligaments, and tendons, my wife does the same thing, but on the face and on the head. So on the face, it's to regrow the collagen. As we age, the collagen dries out all over the body, and people actually get shorter. That's because the discs between the vertebrae and their back starts to dry out. So my wife does the face. It's called the vampire facelift, and it's a non-surgical technique. And what it does is plump up the collagen in the face, make you look younger. So that's an amazing thing. Also, I just want to mention that this book, which I'm showing to people looking at the video right now, Stem Cell and Platelet Therapy, Regenerate, Don't Operate, although the main portion of it is about musculoskeletal problems, knees and shoulders and backs and hips and all of that. There is a chapter on PRP for hair growth, and we use stem cells for that too. And yes, there are studies that show that hair can grow back on the head. And there is something in here about the vampire facelift, which we just talked about. So it's a free book. If you want to call in right now to the radio station, I will send out a free copy of the book to you. And the phone number to the studio is 866-870-5752. We have a caller waiting, but I'll give out the phone number one more time. That's 866-870-5752. And if you want to call the office, you can call now also and get more information. And the number to the office is 800-300-9300. That's 800-300-9300. So, Nita, do you mind? Oh, the caller just disappeared, but here's another one coming up.
I have some information
to
give out to the listener while we wait for those two calls to come back in. The book that you're going to get for free when you call the program is Stem Cell and Platelet Therapy, subtitled Regenerate, Don't Operate. And the foreword is written by Suzanne Summers, who's been writing for decades about health care and talking to all kinds of very progressive doctors, including our Dr. Marc Darrow right here with us. And we are here Saturdays at 10 a.m. and again at 1 p.m. And our number here at the studio, there are still lines open, is 866-870-5752. But call soon. Don't wait till the end of the hour. And let's go to Ego in Glendale. Did I say your name right?
Before we get to...
Oh, go ahead. You want to say something?
Before we get to the next caller, Suzanne Summers has a brand new book. It's called A New Way to Age. And... there's an interview on Dr. Marc Darrow. That's me. It's about 16 pages long, and it's all about regenerative medicine. So she's a great author. She's got, probably 20 books out already. So you can get that on Amazon. So, Ego, can you hear me?
Hi, Ego in Glendale. Can you hear us?
It's a question about the vampire facelift.
Huh. Okay.
I guess not.
Okay.
Maybe the ego went into the subconscious.
Okay. Well, call back in because we don't have you. So
Yeah, we're having callers disappearing right
Yeah,
and
every
left.
time the call pops in, it pops out. So we'll let Suzette take care of that. And in the meantime, I
Why
bet
don't
you
I
have
take
another
the
question.
Endless questions.
I know. As you said
Okay,
earlier,
this one is-
voluminous.
Yes, voluminous.
I love that word. Go ahead.
So the next question I have, I'll take one on a hip. 'Cause
Okay,
a lot
well,
of
we
people
did
have
just
hip
get
pain.
Eric come in from Hollywood. Do you want to take him first?
You think it'll be a ghost this time?
I don't know. Let me
Eric,
try.
Eric, are you really there? Eric, we got you?
Yeah, I am, yes.
All right.
Okay, cool. So, Eric, you've got a knee problem. Which knee is it?
My left knee, it's my meniscus, medial meniscus, the inside.
Okay.
Years back, when you were first getting started, I used to listen to you back in the day, and I had insurance through STAG, and I had a knee problem, and my knee just kind of buckled up, and it was jammed, at like 90 degree, and I was able to work that loose, but I had
Did we just lose another one, Nita?
I don't know. Eric? Eric?
Well, let me take this off
Okay.
off of his phone, unfortunately. Yeah, I'm sorry, folks. We're having problems with...
Oops, I thought we had him, but we didn't. Eric, call back in, 866-870-5752.
Let me just respond to
Okay.
Eric's issue. So we fix people with medial meniscus tears every single day, lots of them. And personally, I have one on my right medial meniscus. And I've injected that, and I can actually see it under ultrasound guidance. And that tear has basically just healed up. So, Eric, you're still with us?
Let me see if I can grab him on this other line. Okay, Eric?
hello.
Yeah,
Hi there.
Eric, let me
Okay.
I'm doing a little work on your medial meniscus right now, so hang with us, and then I'll get back to you. So I was just telling the audience that I had a medial meniscus tear on my right knee, and it was really excruciating. I'd been over-exercising, running, and playing golf, and it was hurting, but I didn't listen to it, so I just kept aggravating it. And then it got to the point where I was playing one day, and I couldn't even finish the game. I had to drive into my office. I drove right down the hill from Mountain Gate, where I play, to my office, which is on Wilshire. And I looked with the ultrasound, and I had a giant effusion. Effusion is fluid inside the knee or anywhere else in the body. So I numbed it up. I took the fluid out, and I injected stem cells and platelets at that time. And I'm going to probably go running today, and if it's not too hot, I'll probably play golf. So my knee is good, and it felt better within just a few days. It's not usually that quick, I'm going to be honest with you. It usually takes a few treatments for something like that. But I'm doing great, and you mentioned that your knee buckled, and usually when a knee buckles, it's from pain. And the brain, when there is pain, will stop the muscles from contracting, and then knees will buckle. I don't know if that's what happened with you, but it sounds like it. And as long as that knee is not stuck in one position, and you can bend it back and forth, you're in pretty good shape. Was that the case?
I'm hoping I'm still on. Am I on, Doc?
Yes, you are.
Yeah, you're
We hear
on,
you great.
baby.
Yeah. I think it dropped right when I was about to say I had surgery on that knee. They took out a third of my medial meniscus, and although my knee is stable and I get a lot around, I'm very active with bodybuilding.
Okay, Eric, hold on for a sec, please. We have to take our quick little break here on Living Pain-Free with Dr. Marc Darrow. Grab a pen or a pencil, write down this important information about to come your way. I'm your host, Nita Valens, and we're going to be right back.
You're listening to Living Pain-Free with Dr. Marc Darrow. Dr. Darrow's practice is located at the Darrow Stem Cell Institute in West Los Angeles. To schedule an appointment, call 1-800-300-9300. That's 1-800-300-9300. Dr. Darrow will be back in just a moment. Stay tuned.